So coming to talking about inflammatory bowel disease, so we categorize this into Crohn's disease and ulcerative colitis. I, Dr. Nitish Gurav, Consultant Gastroenterologist from Institute of Laparoscopy and Gastroenterology, will be talking about inflammatory bowel disease. Inflammatory bowel disease is categorized into Crohn's disease and ulcerative colitis. We know that these are autoimmune disorders and there is no specific reason why this starts in a patient. In general, it occurs in middle-age group, and these days we are seeing cases affecting the younger population too. So patients usually have sedentary lifestyle, and the lifestyle along with the dietary habits, which is more of trans fat and high in calorie, low protein, these are usually which increases the inflammation in the gut. So this is one reason postulated why inflammatory bowel disease happens. So coming to how do we reduce the gut inflammation? So one way or one method how we can bring this down is by replenishing the good bacteria in the gut. So patient who have increased population of or a variety of good bacteria in our gut usually tend to have better gut immunity when compared to patient with inflammatory bowel disease. So here comes the role of probiotics and prebiotics in inflammatory bowel disease management. So prebiotics are those compounds which help in growth of good bacteria, and probiotics are those products which have excess number of good bacteria. So this reduces the pathogen bacteria in the gut and it increases the good bacilli basically. So usually in general the patients with having good bacterial milieu, they usually have increased lactobacillus rhamnosus and bacillus subtilis population. So we have drugs these days which also give fungal spores which are better for gut immunity. So along with bacilli, we have drugs which deliver spores which increases the good bacteria in the gut, contributing to reduced inflammatory pathways in the gut. It increases the intestinal barrier. It makes the gut less permeable to inflammatory cytokines. It increases the medium chain triglycerides in the gut, which by default have anti-inflammatory property. So we on this inflammatory bowel disease week promote gut health, and one way is to replenish the gut bacteria by use of probiotics.